And spurred by a KXAN investigation into medical debt, last fall, Texas passed a new law making it easier for you to understand your medical bills after treatment. Hospitals and other health providers asking for a payment from a patient must now give them an itemized invoice. But KXAN investigator Arzo Dost learned the state is now looking into complaints from patients who say they still can't get details on what they owe.
This is where the magic happens. This is like showing real skills.
Casey Ibarra is back to doing what she loves. The hairstylist from Liberty Hill.
Oh, we're putting orange in.
Yeah.
Says she finally feels like herself again.
And there's some times where you might have like a bout of being uncomfortable.
In November 2020, her sister needed a liver transplant. Ibarra was a match. They traveled to San Antonio to have the surgery. This is the moment captured on video right after the liver transplant.
She has girls, she has a husband, she's still young, but really it was like kind of selfish reasons, like not wanting to lose my sister.
After Ibarra returned home, she says she started having complications.
I just started not really feeling good. And I kept having to go to the ER to see, what could possibly be going on.
Ibarra says she went to a Williamson County hospital for treatment. Then last February, she was shocked to learn the hospital was suing her for nearly $4,500. She has insurance and says she tried to make payment arrangements for anything not covered. She also says she asked for an itemized bill to understand the charges, but never got one. Earlier this month, she went to court to fight the case.
They're suing us for not paying, right? But they're also suing my husband. My husband never got services there. So they threatened that they could take our land and that they would garnish his wages if we didn't pay.
Ibarra isn't alone.
That has been a common defense in the testimony of the defendants in this courtroom, is that I was never given an itemized bill. I had no idea what I was being charged.
Judge Angela Williams, a Williamson County Justice of the Peace, says the year she's been in office, at least 60% of her small claims caseload have been for medical debt.
I think it's important that individuals have the ability to examine these itemized bills and know what they're being charged prior to a court date.
A new state law is supposed to do just that, and Judge Williams is making sure Central Texans are aware. She even has a copy of the law right next to her during medical debt cases. The law requires hospitals and other healthcare facilities that ask for a payment to give patients a written itemized bill before sending them to collections. It also says the itemized bill has to be in terms the patient understands, and it can be issued electronically through a patient portal.
Just providing information to individuals, I think, is important, that they may not know about the Senate bill. And if they have a future medical bill, then they know their rights.
The Texas Health and Human Services Commission is overseeing the rollout of the law and compliance. Since the law went into effect in September, the agency has had 2 complaints. Late last year, HHSC posted draft rules online and gathered informal comments from providers, including clarification needed on some of the language of the law and concerns about the costs of providing itemized bills.
We really think it might just be a misunderstanding of the way that they're interpreting the bill. And so we're going to work with them and make sure that everybody's on the same page.
State Representative Caroline Harris Davila pushed for the legislation last regular session. Could we see the law implemented across the country?
Absolutely. If I have anything to do with it, and I will, and I've already started, this will become law all across the country. That will be such an exciting thing. That's what we're working on, because that's what patients deserve to have.
She says it's too early to tell if any changes are needed in Texas, but she's already looking ahead.
It's just a lengthy process to get the itemized statement, even if you request it. And that's actually something that we will try to work on next session, because I heard from people, well, yes, I noticed an error in my billing, but it took me so long to get through to the billing department to figure it out and get it resolved. And so I think that's a piece that we're recognizing now that this law has been into effect.
Ibarra's case was dismissed because the lawyer for the hospital failed to appear in court.
There's one that's like an $11,000 charge on there.
Days after she was in court, she got some of the itemized invoices, but details of what services were provided were blacked out. She kept calling the hospital and says she finally got invoices without anything marked out.
How do you trust a system that's supposed to be there to help you, make you feel better, find things that are wrong with you? It's like you get punished, because you're sick.
Arzo Dost, KXAN investigates.
Just like that.
The law doesn't apply to cases before September 1st. It's why we're not naming the hospital, because Ibarra's treatment happened before the law went into effect. But Representative Harris Davila hopes hospitals will still work with patients from older cases. The Texas Hospital Association, which opposed the law due to costs it anticipated, says in an emailed statement it issued comprehensive guidance to help Texas hospitals comply with the law. The statement goes on to say that while this work comes with significant administrative cost, Texas hospitals are committed to making sure patients have transparency about their bills. Arzo told you about the state looking into the two complaints, still pending investigation. KXAN investigators have also obtained 5 itemized medical billing complaints made to the Texas Attorney General's office since September of last year, when the law went into effect. We've asked the AG's office about the status of the complaints filed and the process to investigate them, but no response has been provided. Among those complaints was one from a patient in the Dallas-Fort Worth area.
I remember crying to them on the phone, I cannot get a hold of this. I've never had this much problem receiving an itemized bill.
And tomorrow on KXAN News at 11 a.m., you can hear how she finally got an itemized bill and how her push for transparency can help you. And if you're having trouble getting an itemized bill, you can file a complaint with the state. As this legislation became law, KXAN investigators tracked every step. Catch up on how we get here online and how you can file a complaint if a provider is not in compliance. We have a link in the story and our previous coverage in the investigative section on KXAN.com.